The COVID-19 pandemic has been a global health crisis affecting people of all ages. In India, there have been concerns about the impact of the vaccine on young individuals, with some myths circulating about its safety and efficacy. Some myths even made it to the headlines that suggested that the COVID vaccine could be linked to heart attack related deaths in the country. Is the vaccine really killing the young Indian heart? Let's deep dive with India's top cardiac surgeon.
See, there is a very small percentage where the incidence is there, but this is mostly related to having COVID and during the recovery period. Post-recovery period only related to vaccine. Vaccine has certain very rare. You have to understand that almost 800-900 million people got vaccinated. When that huge number of people get vaccinated, anything happens. It also is a coincidence. Before also vaccine, in 800 million people also similar type of heart incidences were happening. Now to the COVID vaccine, everybody blaming the COVID vaccine. COVID vaccine had a very limited role in certain very specific situation. I will not go into those micro details where it happens. And that was usually during the certain period, not after 3-4 years of or 2 years of having a COVID vaccine heart disease incidence linked to that is very, very rare, and it is not related to that, not especially to blockage. You get a cardiomyopathy, etc., that is very related and very specific to younger people. So, it is not related to COVID, it is mostly related to lifestyle change. That lifestyle, as you know, everywhere, all youngsters are no exercise, always screen time, as I said earlier. The food habit has completely changed. Instead of eating natural food at home, which is from natural ingredients, directly cooking, we are all constantly eating processed food. Processed food, you have to understand, mostly made out of processed food, very quickly gets absorbed in the body. Your sugar level suddenly spikes up. When sugar level spikes up, body has to secrete insulin. When insulin comes down, then immediately you start feeling hungry. On the other hand, if you are taking unprocessed natural food, which our ancestors used, it takes a very long time to get absorbed in the body. Your sugar level goes very slowly. So, whatever energy you need, that much was getting released into the system. So, the your pancreas were not stressed out. On the other hand, when you are taking this processed food, very quickly get sugar level goes up, insulin secretes, sugar level goes down, you feel hungry again. So, you eat again. So, you feel more hungry when you take processed food, eat more often, your calorie requirement goes on. And this also has a very high content of sodium. So, all these things has led to obesity, high blood pressure, diabetes, lack of sleep, stress. All these things have led to younger people getting heart disease. In 93, when I came back to India, I will be seeing one patient in a year below the age of 30 having a heart problem. Today, I see almost every day, every alternate day. Not only that, I have started seeing patients in the 20s and 30s. If you ask me, 80% times when I go and deep dive into the region, majority cases is lifestyle. It is related to either smoking, vaping. Vaping is another stylish thing. They think that it is not, it's less harmful to the body. Smoking, vaping, hookah, lot of them from IT industry working very late night, 3-4 o'clock. And then what happens when you work in that environment, you are smoking, you are ordering food, 3 o'clock in the night eating food is very dangerous to the health. And the very important thing, eating food also has a time, because your body also needs rest. So, you have to eat in a particular time, and your last food should not be more than 7, 8 or maximum 8 o'clock in the night, because after that you are sleeping, even not sleeping, body also needs rest to recover the whole process. When you don't do this, all these things lead to a continuous inflammation process inside the body. All the arteries that supply blood to the heart and all over our body, it has a very nice lubricating system God has given. That's called endothelium. That's one keeps with the arteries clean all the time. So, all this lifestyle that I talked produces inflammation. The endothelium becomes unhealthy, it gets damaged. Once it gets damaged, all the cholesterol and everything starts getting deposited. That is the beginning of the heart disease. And also once it gets inflamed, it doesn't have any more lubricating effect. So, So the blood clot can form. Even a person without any blockage can get a heart attack. That's what the youngsters are getting. Quite often we are seeing that somebody had their binge watching for 24 hours, then suddenly drop dead, or working very hard in finance or IT industry late night, and then they get heart attack. These are the common causes where people are getting heart disease rather than the vaccine. Vaccine is very, very, very small component of people.